We were in the discussion on the large intestine. We have already completed the discussion on the ascending colon and the transverse colon with a brief note on the transverse mesocolon. In the next part of our discussion, we will start with the descending colon. It extends from the left colic flexure to the left pelvic brim and is about 25 centimeters long and 3.5 centimeters in caliber. The descending colon is covered with peritoneum in front and at the sides. Behind, it is usually non-peritoneal. Sometimes, however, it is suspended by a mesocolon. It occupies the left hypochondrium, left lumbar region and left iliac fossa. The lower part of the descending colon is sometimes called the iliac colon. Posteriorly, it is related to the lower pole of the left kidney, left iliopsoas muscles, subcostal vessels and nerves, the left gonadal vessels and the left external iliac vessels. Coming next to the sigmoid colon. The sigmoid colon begins at the left pelvic brim as a continuation of the descending colon and ends at the rectosigmoid junction in front of the third sacral vertebra, that is S3. When it is of average length of about 40 centimeters, the sigmoid colon describes an S-shaped loop and is suspended from the posterior pelvic wall by a peritoneal fold, the sigmoid mesocolon. The loop presents three parts, namely the first part which passes vertically downwards along the left pelvic wall. Second part passes horizontally from left to right between the urinary bladder and rectum in males or between the uterus and rectum in case of females. Third part passes obliquely from the right pelvic wall to the rectosigmoid junction opposite S3 vertebra. Coming to the measurements, length we have already described 40 centimeters, breadth 3.5 centimeters, minimum length 5 inches, maximum length 3.5 inches. We won't go into the detailed relations of the sigmoid colon. Rather, we will shift to the description of the sigmoid mesocolon. Now, the sigmoid mesocolon is a peritoneal fold which suspends the sigmoid colon from the posterior wall of the pelvic cavity. The root of the mesocolon is inverted V-shaped. The apex of the root is situated in front of the bifurcation of the left pulmonary iliac artery, and the left ureter enters the pelvic cavity behind the apex, lodging in the posterior wall of the intersigmoid recess of the peritoneum. The left limb of the root is attached along the left pelvic brim up to the junction of the descending and sigmoid colons. The right limb of the root is attached obliquely to the pelvic surface of the sacrum, extending from left sacroiliac joint to the middle of the third sacral vertebra. Now, what are the contents of the mesocolon, sigmoid mesocolon? They are the sigmoid colon to start with, sigmoid branches of the inferior mesenteric vessels and the marginal vessels of Drummond, a branch from the superior rectal vessels, lymphatics and nerves supplying sigmoid colon, and loose areolar tissue and a layer of fat. So, with this, we will end our demonstration of the various parts of the large intestine. Thank you.